Welcome to the Adelphi New York statewide breast cancer hotline and support program STEP video series. I'm Tjaden, and I'll be discussing the role of physical therapy in managing pain, improving mobility, and supporting recovery in cancer care. I'd like to start off talking about a couple of thought-provoking questions, and I want you to think of it as if you just had surgery. What would you do if your ability to dress was not getting easier due to pain? Ask family members to help? Change the way you put on your clothes? Mention to your surgeon? Or push through the pain and just try to ignore it? What would you do if you realized you could not reach into a cabinet above your head after being cleared for activity? Get a chair or step stool to stand on? Ask family members and friends to continue to help? Mention to your surgeon? Continue to push your arms up and stretch despite the pain or the compensation to do it. And what would you do if you found yourself having tightness and pain limiting your posture? Continue to have poor posture? Search the internet to ask friends if they have any exercise suggestions? Mention to your surgeon? Or try to be conscious of your posture even if you have shoulder, chest, abdomen pain. Just ignore it. And what would you do if you continued to have swelling in your arm or throughout your surgical areas? Nothing. You figure it will go away. Search the internet for a video of lymphatic drainage from an unknown source. Mention to your surgeon. And search the internet for some type of compression garment to purchase, which most likely would not fit correctly or be made of the proper material. And last but not least, what would you do if you were unable to return to your favorite exercise routine? Decide not to go back to that activity you love. Go back to it anyway with limitations. Mention to your surgeon. Or do something different because of this diagnosis. It is normal soon after breast surgery to experience the following post-surgical limitations, and very important to mention to your surgeon all of the above. To have difficulty reaching overhead or out to the side to get dressed. To have difficulty reaching into a cabinet. To struggle with upright posture. And to have post-surgical swelling throughout the surgical area. Physical therapy can help with all of these impairments. So when should physical therapy begin? Early identification of these post-surgical limitations prevents these issues from becoming problems. When we wait too long, oftentimes people present with shoulder, neck, or back pain, or even swelling that has not resolved. So this typically takes place when cleared by the surgeon, usually within 3 to 6 weeks after surgery, depending upon the reconstruction procedure. Why physical therapy? Physical therapy is part of so many surgical procedures. For example, if someone were to have a total knee replacement or a cardiac surgery, patients are sent to physical therapy prior to surgery in hopes for an optimal outcome post-surgery. So the question here today is, why is physical therapy not a part of every plan of care for a patient diagnosed with breast cancer? We work on pre-surgical evaluations, the benefits, post-surgical care, before and during chemotherapy, in preparation and during radiation and actually after. We provide emotional support, and we take a team approach. So the benefits of a pre-surgical evaluation involve empowerment through education, sleeping and sitting positions that will promote healing and reduce the likelihood of complications. We discuss post-surgical expectations and really setting realistic expectations. We address pre-existing musculoskeletal problems and how they can impact the recovery, take circumferential upper extremity baseline measurements for post-surgical edema, and we educate about lymphedema as needed. Physical therapy can be started at that time, or we have the opportunity to provide a home exercise program if needed. So what does post-surgical physical therapy treatment involve? It's the assessment of range of motion, strength, sensation, pain, as compared to pre-surgical baseline if we are seen earlier. Perform manual techniques, guided exercises to restore range of motion, tissue mobility, flexibility, strength, and endurance. We address tissue restrictions to muscles directly impacted by the surgery. Manual lymphatic drainage education to help decrease post-surgical swelling. We educate on safe techniques to return to everyday activities. And we communicate with surgeons regarding progress or possible concerns. The lymphatic system, the philosophy behind our practice. This is certainly one of the biggest concerns of many patients, and one of their first questions is, will I develop lymphedema? It is a very complex case. It really involves its own time and space to be discussed. But typically what it's based on is a sentinel node dissection, first axillary node. Sentinel meaning testing, axillary taking more, radiation treatment, and body mass index. Now, the surgeries are better, but the risk is still there. What we do have now is better management of how to treat lymphedema. And getting to therapy early is truly the key. It is important to restore full range of motion. Oftentimes patients come in and this type of range of motion is okay, but we really need full range of motion to allow for muscle pumping of the lymphatic system. And then we progress with strengthening to build up the endurance of that system through the PAL study, which was evidence-based practice that we've been following since 2010. Patients come in before and during chemotherapy, and the goal at this time is to prevent severe conditioning to modified exercises, to get to therapy for manual treatment, and they really are surprised by the amount that they can do once they get to the office. They receive emotional support from physical patients and other women in the clinic, and they collect numbers with others with whom to keep in contact. Before and during and even after radiation, we work to regain range of motion, which is needed for upper extremity mobility, for positioning. We teach patients they understand that certain activities need to be modified. We perform self-manual lymphatic drainage, and they are able to comfortably maintain this positioning during radiation, which is up over the head. They then continue with their home exercise program. It typically is modified, and we continue with manual treatment to maintain the mobility. And oftentimes patients do take a break from therapy, and then they come back for a new plan of care within 4 to 6 weeks after, because patients commonly develop some type of tightness. The emotional support. This happens to be a very big part of what we all do together. We provide guidance and support through education, empowerment about taking control over this diagnosis, by delivering a community of support that ranges from patient advocates, support groups, financial assistance, bra and wig boutiques, and sharing tips on way to manage chemotherapy and radiation challenges. By being informed that the goal after treatment and surgery should involve living with very few limitations in function or quality of life. This early physical therapy treatment has the ability to decrease this vicious cycle of pain from progressing. We commonly see this when we don't see people early. Pain post-surgically is very common. The physicians do not want you going over your head until the drains are removed. That can contribute to decreased movement, which contribute to decreased activity, and fear of movement leads to weight gain, deconditioning, and pain. We take a team approach. by providing communication between physicians and patients. And we typically see patients 2 to 3 times a week, so we have the ability to do that. It allows for a second set of eyes on surgical incisions, and we get to identify if a patient is running into a problem or they're not progressing like they should. And patients have lots of questions. We're here to help guide them to the appropriate physician or support staff. And this decreases the emotional burden on the patient, allowing them to be guided directly to them, and even the physicians as well. We here on Long Island have a wonderful community of providers. We really work together to be in contact and make sure the patients are feeling this type of approach. It is very easy to text, email, or make a phone call when someone is running into a problem or even when they're doing well. A team approach, it involves so many people: physical therapists, breast surgeons, radiation oncologists, plastic surgeons, social worker, psychologists, support groups, coalitions, and complementary care. In summary, knowledge and education empower patients to take control over their recovery. Physical therapy is recommended pre and post-surgery. Physical therapy is important pre-surgically to address pre-existing muscle imbalances and/or strength deficits, orthopedic conditions, and provide education. Physical therapy is important post-surgically to restore range of motion, flexibility, tissue mobility, and strength. A team approach completes the plan of care needed for optimal recovery. Thank you for joining us. We hope you enjoy the STEP program video series. For more information, visit us online.